Malo pito whina. Tukua taku wairua kia riri ki ngā taumata haiarahi I aku mahi me taku whai te ao marama, kia mau, kia ita, kia kore a engaro, kia pupuri, kia whakamaua, kia tina, tina, haumie, huie, tai kie.
Tēnā koutou katoa, nau mai, haere mai ki te huihuinga o tēnei rā. Malo tau mau ke bongbongi ni ko tali whiwhia mo tolu ko tope mo si mea mai he ope ke tau kau whakataha he bongbongi ni. And of course, a very warm greetings to you all from the glorious but slightly nippy Ōtautahi Christchurch. To the unchurched of you, the Christchurch is also known as the Promised Land, and I won't have it any other way. My name is Finau Leveni. I'm the Programs Manager for Caritas Aotearoa, and I have the privilege of being your MC for this morning as we gather to share a snapshot of the good works that have been enabled by your overwhelmingly generous donations to the Hunga Tonga Hunga Ha'apai volcanic eruptions and the tsunami response. Now, in a moment, I'm going to give a brief outline of the wonderful program that we have in store for us today. But before I do, I would really, really love the opportunity to introduce you to our new CE, Chief Executive, Kai Whakahaere Matua, Miss Mina Antonio. Now, Mina has started with us on the 1st of this month, and today being the 30th marks a full calendar month that she's been in the role. But although new to the role, Mina brings a wealth of experience in the NGO sector, including leadership and strategy, risk management, legal and financial compliance, and people management across some highly regulated sectors. So literally that translates to we got an amazing deal in getting and being able to secure Mina. She's a lawyer by training and is the first chief executive of Pacific descent, being Samoan and Tokelauan. We are incredibly blessed to have her on board, and I would like to now give the opportunity to Mina to say a few words.
Malo pito Finau, and thank you for that humbling the introduction. To you all, malo lele ki e pungi pungi ni, ko hoku I ngoa, ko mena Antonio, malo e lava mai. Tēnā koutou katoa, mōrena, tātou, and a whio mai, nau mai, haere mai. Look, I just want to acknowledge you all for coming together, not only today, but also in the leading up to, in response to this incredible situation that has unfolded in Tonga. I send our ofalahi atu to our sisters across the moana in Tonga, as well as to you all on this land of Aotearoa. So I look forward to seeing what our staff have done in this incredible response. And again, just thank you all for your support and look forward to meeting some of you. If I haven't already, I recognise you, Laurie. We are both here in Whakaoriori in Masterton, Wairarapa. So we're from across the whenua here in Aotearoa, and I send alofa to you all and thank you in Christ in this mission. Kia ora.
Kia ora, malo pito, Mina. So I'm now going to give a brief overview of what we will be covering in today's session. Can I have the next slide, please? And so what we can see here is we're currently at the introductions and welcome stage, and after this I'll be handing over to the team to actually speak to the overview of the work today, the planned programming coming up, and I think really importantly as well, how it actually fits into the overall programming of Caritas Aotearoa. We're giving this maybe about 20 or so minutes, And then, of course, there'll be the opportunity for some questions and answers afterwards. So while we're hearing from our wonderful speakers today, think about those questions that you would want to be answered. There's the opportunity for you to be able to place them in the chat if you're a bit shy to ask them outright, or if there's quite a bit of movement, feel free to put it in the chat and one of our team will pick it up and ask it on your behalf, but certainly there will be the opportunity there. Also just flagging that you would have received a prompt about recording. We also want to make this available for those who are unable to join us this morning. So with let's just get straight to it. My job really is to just introduce things and then get out of the way. So I would like to hand this over to Rachel Harrison, who is one of our program coordinators at the programs team within Caritas Aotearoa, and of course we are so incredibly blessed to have Suliana Maka, who is the Chief Executive for Caritas Tonga, and also Malia Losa, who will also be joining us from Caritas Tonga. So let me hand over to the amazing team who have incredible things to share with you this morning. Malo.
Suliana, feel free to go ahead when you're ready.
Thank you, Rachel. Thank you, Finau. Pamaloa tu Finau no whawhiloa ki maua he kamatanga. Whawhetai ki he otua mafi i he ofa au whuato, o whai mai ki he tau mo'ui o tau au siai, ai au whakaosi o mahina ko e peleli. Tau kei malawa i o whe mātaki, whe longo aki mo whe wahe aki i he ope, whe kau aki mo whakataha mahu ingani. Malo e lelei, ko hoku ingoa ko Maria Suliana Wharemaka. I firstly would like to acknowledge the presence of our Heavenly Father in our midst here today, in which we are provided once again with another opportunity of life, as well as the chance to meet, greet, and share. Since our recent environmental crisis earlier this year with the violent volcanic eruption of Hunga Tonga Hunga Ha'apai and tsunami, the outpour of love, prayers, and aids in any sort from you all have indeed not only assisted and helped many families and communities here in Tonga, but also gave us hope, especially during those difficult times. As introduced by Finau, my name is Maria Suliana Wharemaka, and it is with great respect and appreciation that I joined you all today to share some of the key work that Caritas Tonga had implemented during our recent environmental crisis area this year. Before I do begin, I have a video I'd like to share with you all, which I believe would give you a much better overview of the events that took place here in Tonga on the night of January the 15th, and I kindly ask Rachel if she can play this for us.
fia na ho kwa ai fai tamako ni ko no mo ni ko anga te fa mama hete te fa fo ke manatu ke atani ma ya usia pa mo sia tonu ai ka inga I pare mana ho ko
na fai tafi pe ho mau api pe au whanongo ki he pā raki pā ia ai puna koe ai mō ngāwhi
o whanongo I he mea koe ni ko peka mea no molo ke te talo te tupu ke whanongo koe mana wau o ki ulu pa toki haake he koe o whale pio pahu
Iai mpe mo ki ifoha pe, ki ifoha lahi pe o kaka he fu akau maalunga taha koho mau api kaila mai foha ia mo ulele he koe pe au kulu
hawe pe au he taimi ko o si hake mai he taimi ko ya ki tungwan pe au kaila pe ke na ulele ki uta ma ulele ki loto fonua
taimi ko ya ko set ko ki foha ta u ulele loi mau fa ma ko ta bene ulagi me atu ko ke toko ni au ko ki tamasi tau lele moia o tuko ke to afonua
no pe me ko whanongo ko ke uha koe mwhanki I maka ngangana ko he funga whare.
hoko mai ai koe
me puke mai tapore ni puke tangata pe o to ia fine matua ka mai whanau fu ko ni ko
mau tu pe foka au ha peito ka puke papa fa malo ki kai
maa hake koe ke he aho sāpate mau toki hifo mai ki o mau ki motuni o sio whaka ofala koe whare ne te tu upe ai me ia upe ko toki ia ai tahi he loto kolo
ko kolo o si tu eta
Thank you. I guess this video spoke for itself in summing up the horrendous events our people went through that night. And it is indeed an experience that we will never forget. These events left us here in Tonga with so many damages and impacts, which I would like to invite Ms. Malialosa Tapuelwelu, our project officer here in Caritas Tonga, to talk on as well as also elaborate on the responses that we were carried out before I come in to explain the rest. Thank you. Over to you, Losa.
Thank you, Suliana, Malo Alpito, and again, a very warm Pacific greetings from the island kingdom of Tonga. Thank you very much, Suliana, for the general and brief overview of the historical events our island kingdom experienced 3 months ago. May I continue on to sharing the damages and the impacts caused by this event, which greatly impacted the livelihoods of our people, and we also have lost a few lives. 4 deaths have been recorded. 3 were directly caused by the tsunami, and 1 was due to trauma caused by the events. There were also 10 people reported injured during the event and have been recovered as of date. 3 islands of Tonga have been directly impacted by the event, which is the main island, Tongatapu, and also 2 of the remote islands, Ewa and the island groups of Ha'apai.
That is approximately 84% of the total populations of Tonga. The coastal communities evacuated and moved further inland when the events occurred and have returned to their homes after. Unfortunately, not everyone returned to their home after, as some people have completely lost their homes, and some people, their homes have been severely damaged by the tsunami. Two of the smaller islands the facilities have been completely washed away, and there were severe damages occurred during the event, leaving people, causing people to evacuate from their homes. This all results in some displacements and relocations. These people are still living in the evacuation center prepared by the government, and some families are living with their families here in the main island while waiting for the relocations and the displacement. The places have been confirmed. The process with the land issues and the reconstructions are still under progress. The damages to water and sanitation facilities. These are all from the national damage assessment conducted by the government with the assistance of relevant stakeholders. 310 houses reported complete or severe damages to their sanitation facilities and water systems. Not only the water tanks and rain harvesting system were damaged, but significant damages also occurred to sanitation facilities such as toilets and septic tanks and the water drainage. There were also damages to agriculture. Crop plantations in the area affected by the tsunami have been completely washed away by the waves. Not only that, there are some crop plantations across the islands that were also impacted by the ashfall and the ashes from the volcano. Some of these crop plantations have been recovered and replanting as of today. The public infrastructure and critical service facilities were also impacted. Our international airport wasn't operated for a few days after the event due to the ashfall, the ashes that covers the airport. The main wharves were also impacted, damaged by the waves. Our hospital were also affected as the main generator, as our power, the electric power, was also affected by the ashfall. And this also greatly affected the hospital as the main power generator was covered with ash. The most critical damages that it caused was cutting off our underwater communication cable, disconnecting Tonga from the outer world. This was the most devastating impacts that affected most of our lives here in Tonga, was enabling to contact and connecting with families and other Tongans overseas. It took several weeks up to months before all of these were restored. All these services have been restored as of today. Some have been restored a few days after. Some it took weeks. But the communication have been restored after a month from the events. Our immediate responses that we did right after the event, through our preposition stock project, we were able to distribute emergency relief supplies to affected communities as our first immediate responses.
as our first immediate responses. These items consists of wash kits and hygiene kits for families, and also kitchenwares and blankets. We also did a water response in collaborations with the Tonga National Youth Congress. Water refill stations in some of the communities have been purified, desalinated through this response, enabling the families in these communities to catch safe and clean water for drinking purposes only. The Catholic parishes here in Tonga were being asked for donations of food rations and other household relief items to be distributed to the affected communities. And for the parishes that have few communities that were directly impacted, they have donated food rations and household items and have distributed to these affected families and communities. The remaining of the Catholic parishes that are yet to donate these donations are still currently on hold until further notice, and this will be all under the directions of Caritas Tonga in collaborations with the government agencies and other relevant stakeholders, ensuring that the time of collecting and distribution are necessary and appropriate. As of today, currently from that day up to now, there were still aids coming in from foreign countries, and there was still aids coming in from other donor agencies to the government, and are still under distributions to those affected families. So the assistance from our Catholic parishes are still on hold at the moment until Caritas Tonga, in cooperating with these agencies, sees where fit to be distributed to these affected communities. As we see, this is an ongoing and long-term recovery phase, not only for the affected communities, but for the whole island of Tonga. The psychological and support program, we have been deploying a team to the affected communities after the event, providing psychosocial support and trauma counseling to the affected families. This psychological program were led by our Halaki and Measi counseling team. It is our diocesan counseling team, which is led by Ms. Sinale Leafe'au and her team. We have deployed this team and conducted a psychosocial support and trauma counseling in the most affected communities right after the event. The remaining of the communities are still under the planning as more collaborations with other NGOs and other relevant stakeholders that are also conducting the same program are still currently developing to ensure that we do not duplicate any of these programs. I think that is all. That is just an overview, a general overview of the damages and impacts of the events in our lives here in the Kingdom of Tonga, and also the immediate responses that Caritas Tonga have conducted right through after the event took place. I will now pass on to Suliana to continue on with our presentation. Thank you. Malo Alpito.
Thank you, Maria Losa. As we are working closely alongside NIMO, as well other NGOs here in Tonga, in responding to the crisis, we have been able to identify these various points as the essential needs of the communities here in Tonga, both short-term and long-term. Initially, there is of course the obvious need for the reconstruction and rebuilding of house. most especially in the affected and displaced communities of Kanokupolu, Mango, and Atata. In terms of this, we have decided the Caritas Tonga step back in engaging in any reconstruction projects, given that our Tongan government has made sufficient pledge and plans to work on the rebuilding houses of these communities. However, continue of our PASA and PBS training in communities will be provided in order to enhance shelter resilience of communities and risk reduction preparedness program through our negotiated partnership with Habitat for Humanity in New Zealand. Second to the needs identified is the continuous need of communities to access clean drinking water. As mentioned by Maria Losa before, water supplies were damaged in the affected areas and was a threat because of the excess dirt and dust that had been trapped in the tanks and hence the shortage of water. I guess Maria Losa again has already explained our response done and plan in this area. But I also like to mention our WASH project coordination with Catholic Relief Services, CRS, in which we are planning to install water refill station in the affected communities from the tsunami. On the next needs identified was the provision of NFIs, hygiene or dignity kits, water containers, beddings, clothing, kitchenware is urgent to all households who have sustained some level of damages. Urgent requirement to ensure persons with disability and elderly, including women and young girls' needs are being met, especially those who have been displaced. Noting any temporary shelter provided will need to recognize that this is still the tropical cyclone season and COVID-19 pandemic. So medium to long-term safety and security needs to be considered, especially for vulnerable populations. Supply and continue to provide food, in particular to remote islands, to ensure food delivered are healthy and nutritious and are suitable for children, pregnant and lactating women, as well as for elderly. Need of hygiene, wash facilities in homes, school and communities. Psychosocial support is strongly recommended for all affected households, with extra support for communities that have been severely impacted and traumatized, specifically those displaced and those whose communities and houses were destroyed. There is also an urgent need to replenish our prepositioning stock, as we are currently still in the 2021 and 2022 tropical cyclone season, and with the added complexity of COVID-19 in the community, it has further stretched the resources and personnel we have. Challenges. Moving on to some of the challenges we face here in Tonga with regards to our efforts in our immediate response carried out. It's not included in the slide, but I guess the first and foremost challenges for us staff, as well as the people of Tonga, was overcoming the trauma of what had happened. Because we continue to live in fear with the repeated thoughts that the volcano would once again erupt. More importantly, for us staff, it was challenging to quickly brush the fear aside and have the courage to go out into the communities and implement our immediate response to the crisis. Communication means both locally and internationally was a major challenge given the cut-off of our communication cable. For weeks, we were unable to know the capacity of damages in Ha'apai and Eua, and with the ferries and boats not being able to travel by sea, given the dramatic amount of ash in the seawater and the damage it could impose on boat engines. Therefore, responses were a bit of delay to these areas. International communication gave us challenges of not being able to reach out foreign partners and report the damages and update on our current situation on the ground. Even after having the mere opportunity of hearing and talking with foreign partners, after communications were slowly restored, bank systems were continually shut down, given the internet cut off, and hence excess of funds was a challenge. Another challenge indeed was the access to affected communities. Government had restricted the public from entering with the affected communities, and a great example of that was the village of Panokopolu, Paatangata, and Sesia here in Tonga. This was enforced given the severity of damages and the unsafety of areas for the public to be around in. The last yet biggest challenge now for us in terms of our response work is indeed the rise of our COVID cases here in Tonga, which has forced us into lockdowns and COVID restrictions. Initially, right after the volcanic eruption and tsunami, our work in terms of responding to the disaster was limited and difficult because of the lockdown. However, luckily, we were able to work during these restrictions, although it was limited and most of the times we were working from home. Nevertheless, as right of now, things are slowly being lifted as weeks pass, and hopefully we can be back to normal and working full capacity soon. I would now like to pass on the floor to Rachel to talk about her part of the presentation, as well as wrap up our presentation for today. Thank you for listening. Malo aupito.
Malo lahi Suliana and Malialosa. Malo elele everybody. My name is Rachel Harrison. I'm a programs coordinator at Caritas Aotearoa New Zealand. And it's been my privilege to be working with the Caritas Tonga team over the last few months in this response. So I'd like to start firstly by saying a huge malo apito, thank you very much to Suliana, to Malialosa, and to the team in Caritas Tonga for the huge amount of work that they've done over the last 3.5 months now on this response. The resilience that they've shown and the strength that they've shown in supporting their communities and putting the Caritas support into action on the ground in Tonga has been absolutely amazing. So I'll just talk a little bit about the Caritas response. Caritas Aotearoa New Zealand is coordinating the international Caritas response. So you can see a list here of various Caritas organisations across the world who have contributed money to this response. That's flowing through Caritas Aotearoa New Zealand to Tonga as the response goes on. So that's one part of the response funds, but the main part of the response funds has come from public appeal donations in New Zealand and Australia. So what we're seeing here, well over $500,000 from the public in each New Zealand and Australia has come from really generous donors such as yourself. So it's wonderful for us today to be able to see you and share what's happening on the ground, and thank you for your support. And it's wonderful to have Suliana and Malialosa here who are on the ground doing all the work, updating you themselves. So thank you everyone for making the time to be here today. And as you can see, the public outpouring of support has been extremely generous in the wake of this response. So a little bit about how Caritas often responds to humanitarian emergencies like this is generally we do something which is called a disaster response partnership with the New Zealand Ministry of Foreign Affairs and Trade. which is a contestable fund that we can access to support responses like this. However, the slight downside of that is that those funds are very tied. They're tied to very specific activities. They're tied to specific timelines, and there's quite high reporting burdens for the teams on the ground. So what we can say with this response to the event in Tonga is that because of the generosity of donors such as yourselves, we haven't had to go down that route with government funding. We've been able to fund this response entirely from public support and Caritas organisations, which has been really, really amazing. It's given more freedom to the team on the ground to lead how this response should look. They're working together with the government of Tonga and also the Tongan National Emergency Management Office, or NEMO, which Suliana mentioned before, to figure out what's really best for their communities as time goes on. So what we're looking at in this response is a phased response, and it's likely to last up to 2 to 3 years. And this will happen in a variety of different ways. So you can see some notes here. We're looking at rebuilding livelihoods that were lost through the eruption of the tsunami and then the subsequent COVID-19 lockdowns. And that will look like agricultural training, access to seeds, access to funding for groups and community members to rebuild their livelihoods that were lost after the event. There's also going to be a strong focus on promoting resilience. So continuing the psychosocial support that Malialosa talked about before, counselling and trauma services especially for communities that had to be relocated or evacuated, but also WASH training. So Suliana mentioned WASH before. WASH is water sanitation and hygiene training. So we'll be looking to communities to help train their resilience in water and sanitation and hygiene in the future, to go alongside the support that Catholic Relief Services in the United States, which will be supplying water tanks to communities. So training to support communities to maintain those infrastructural outputs into the future with further disasters. Because unfortunately we know in a country like Tonga, and Suliana mentioned this already, cyclone season is a big thing. These disasters unfortunately do happen. So long term, we're going to be looking at continuing to support the community to be prepared for such events in the future. So the amazing thing with this funding is that we can look at different phases. So we can say this is what the need is in the community for the next 6 months, but the following 6 months, the need might be completely different, and we can adapt to that with the flexibility of the funding that has been provided by generous donors such as yourself. So thank you very much for that. I might just jump now to show how this links to the wider Caritas Aotearoa New Zealand work. So Marita, if we could jump to the next slide, please. Thank you very much. He oranga taurikura, which is the Māori phrase for a thriving life, is the program that Caritas Aotearoa New Zealand will be carrying out in the Pacific and Southeast Asia over the next 5 years. So we'll be working in 7 different countries, as you can see here. Tonga, Kiribati, Fiji, the Solomon Islands, Papua New Guinea, Timor-Leste and Cambodia. And the focus of this program over the next 5 years is on improving health, well-being and resilience of the communities that we work with. So we're working with 9 different partner organisations such as Caritas Tonga in these 7 countries across the next 5 years. The programs in each country will look slightly different depending on the needs of the community, but they all have that overall goal of increasing health, well-being and resilience. And this program, the amazing thing about this program is that for every $1 donated by donors such as yourselves, by Catholic parishes, by Catholic schools, the New Zealand Aid Program, as part of the Ministry of Foreign Affairs, will add $3 to that. So our program over the next 5 years will be a 1 to 3 match with the Ministry of Foreign Affairs. So that really does mean that every dollar donated has a much bigger impact across these countries, which is amazing. In terms of the He Oranga Taurikura work specifically in Tonga, if we can jump to the next slide, please, Marita, thank you. We're working at the moment to make sure that this program is really aligned with all the activities that will be occurring through the eruption and tsunami response that we've just outlined here. So this is likely to look like livelihood support for groups with through microfinance initiatives. So it's helping fund women groups for tapa weaving, or groups for agricultural activities, really just supporting grassroots community initiatives to fund livelihoods for community members. We'll also be looking at carrying out disaster risk reduction training for communities. So like I mentioned before, that's preparing community members for disasters in the future and how to prepare for and how to respond to them. And finally, to support the WASH, or the water, sanitation and hygiene work, we will be carrying out trainings for communities in how to maintain their rainwater harvesting infrastructure. So rainwater is a very important source of drinking water in Tonga. There's not a lot of freshwater resources across the islands. So rainwater is crucial, and especially in the current climate with rising sea levels, salination of water sources, and increasing drought, the rainwater that's collected is hugely, hugely important to the communities. So training them in how to keep their infrastructure safe and functioning so that the water is safe to drink is a really important part of He Oranga Taurikura in Tonga. So really that's just a little brief outline of what will be happening over the next few years in Tonga, both with the emergency response, but also with our regular development programming in country. And hopefully that's provided a good insight into how those link together and how your generous donations have supported all of this work. So again, malo lahi o pito to everyone who's donated, and to the team in Tonga for all the amazing work you're doing. And we look forward to being able to continue to update you as these programs go on. Malo pito.
Malo pito, Rachel, and malo pito to Suliana and Maria Losa as well for those amazing insights. That brings us to the end of our morning.